Hello and welcome to this edition of One Company, One Video. This time it is Lineage Cell Therapeutics, a stock that I've owned, for one way or another for the last 2 decades. But really, this is going to be about the company, less about the stock, because, well, it's an interesting story. Before we get any further, I am not a certified financial planner. I'm commenting on my own finances, not somebody else's. And this is also a story about the company rather than the investment potential, because I think it's a fascinating story, as every company is a story. So I've decided to tell my version of those stories one company at a time. Lineage Cell Therapeutics is an interesting company to me because it has, well, if you can see from this video, there's some fairly high end stuff going on there, but it really has, with so much biotech, is happening at a level that you really can't see without a microscope. Let's go over here to what they're working on. If you look over here in the development section, there are treatments that are required for retinal cell ailments, spinal cord and damage and injuries, immune cells, other things as well. And what they're doing is they're working with, well, what I colloquially will call stem cells, though of course they're going to be calling pluripotent cells, because those are really powerful cells. Those are the things that differentiate all the different parts of the body, which is how we become what we are from a sperm and an egg. As much as they're doing a lot of different things, I'm going to concentrate on the two top ones on their pipeline. The one has to do with dry eye macular degeneration, and the other is spinal cord injury. If you notice, they're both in phase 2, and they're not exactly large trials, but then again, these are also experiments, as every trial is. But it's also, they're not trying to cure the common cold, they're trying to cure things that have no other cure, particularly the spinal cord injury. And I'll start with that one because that's the one that really drew me to it. There is a large unmet market in, well, aiding accident victims. Let's see if they're cycling through their video. This gentleman here is somebody who was in an accident and has now gotten back to the point of being able to use upper body strength and whatnot. This is the sort of thing that, while a pipeline, come on here, pipeline, while a pipeline can show where it is and the progress and whatnot, I know they get news coverage when they can demonstrate and have demonstrated the fact that somebody who was in an accident has actually regained motor function. That sounds like a clinical thing, but imagine somebody who couldn't walk or who couldn't use their hands who suddenly can. Well, not suddenly, but by properly injecting and applying stem cells, they help the nerve cells regrow. The spinal cord injury, as a matter of fact, is what they're concentrating on specifically. To me, that is a really strong message. That is less anecdotal, or no, take it back, less academic, more anecdotal, but it's also a heck of a powerful thing to see somebody who's actually recovering that much. You're not talking about somebody who feels better and you're just trusting them to say, I feel better. You're actually seeing the fact that what they couldn't do, they now can do. Of course, they're in phase 2, they're not in phase 3, and they're a ways from FDA approval, as so many leading edge technologies are. Dry macular degeneration is a similar sort of thing where there may be treatments for various aspects of it, but what they're trying to do is regrow cells in the eye so that folks who were, well, had degenerating eyesight can possibly recover it. Those are things that are being done at a level that, for instance, you're basically they're not having to add something to the body, they're having the body do some of the work. And I really like the idea of helping the body help itself. Uh, those are the kind of things that stem cells have always been claimed to do. And for instance, it's one of the reasons I bought into a company called Geron, which I just talked about last month. Geron at one point was running out of cash and spun off their stem cell work, or some of it at least. And this is where it ended up. Now, it actually ended up in a different company that became a different company, and there's all those kinds of things. So effectively, I've been invested in this technology since 1999 via Geron and other companies. But here it is now, Lineage Cell Therapeutics. They're not in FDA approval, they're not in phase 3, but they're getting close, and they have some wonderful anecdotal evidence, which is very encouraging to me. Uh, it is the sort of thing that is anticipated. The closer you are to somebody who is in that situation, the easier it is to get interested in how it's going to come out. And I don't know exactly what the competitive market is in terms of how many competitors there are, but in large part, as I understand, these are two large unmet needs, at least to the extent that they're talking about. And of course, they also have, here's one for lung cancer, a particular type of lung cancer, hearing loss, and other forms of blindness. Let me get this out of the way. Thank you. So there is potential. It's a wonderful potential. I'm going to pull up the stock chart here, mostly because it has the market cap on it. The low market cap. Market cap is under $250 million. So on the one hand, $250 million is a lot of money. On the other hand, as far as biotechs go, that's a fairly small thing. And since I brought it up, I'll just show that it has had a heck of a ride. Nice resurgence at around 2010, and since then it's been arguably just kind of drifting down with a little bit up. And it'll be interesting to see, because as this stock chart has been progressing, their technology has been progressing. But of course, the technology has been improving, and the stock's been declining. It's an interesting combination. While some of these are in rough times because this is expensive kind of work to do, they have, let's see if I can pull up the, come on. They have enough cash to last, there we go, through, as of June 30th, 2022, they have enough to get through second quarter 2024. The other thing that's going on with this is that they're partnered with Genentech, which is a good size name, and California Stem Cells. So that is some nice confirmatory. Well, heck, I mean, it shows that other folks care about them and trust them as well, which is encouraging to me. Really, the story is going to take a while. And at one level, it can be incredibly simple, but that's actually one reason I like this company. It doesn't take much to explain the fact that you're trying to cure at least one type of blindness, or at least to help one type of blindness. You're trying to help people that have spinal cord injuries. Those are straightforward. And I think because of that, as they get closer to FDA approval, assuming they get it, market sentiment will be easier to attract interested investors, because it won't take as much explanation as to what they are working on and whether or not it is working. Within biotech, sometimes that can be a difficult thing. Now, currently it is down, and while I'm not primarily talking about the stock does enter into it because of course, why else would we be having this conversation? I'm going to talk about companies that I'm invested in, but I'm also only going to, well, if they're invested in them, I have stock, and therefore it's another measure of the company. So this may be really short, because here we go. We've got this one company. It has a platform which is based on some really impressive ailments if they can capitalize on it. And the other thing is that as those procedures, as those treatments progress, if they succeed, then it'll be interesting to see if it can then be expanded and extended to other treatments as well, in which case there's a multiplying effect on the value of the company, as my opinion. Again, I'm not a certified financial planner. This is just some guy that's been investing for decades. So with that, I'll pass this on along to the archive of the YouTube universe and enter into the list I have here of one company, one video. It's also going to be on my website. While I've been invested in it one way or another since 1999, I've also written about it somewhat recently, 2020. And every 6 months or so, I also put together a semi-annual report on my portfolio, which is handy because while I'm talking about this company today, the semi-annual report gives you an idea of where I am every 6 months or so on this. And it is one way to kind of track how their story is progressed, at least from my perspective. And that is what it's worth. Sorry, there's a not trying to get a plug in for my other book. I just wrote a book. Hadn't intended to go then. We'll see if that gets edited out. Anyway, with that again, this is Tom Trimbath, author of Dream, Invest, Live. That's actually why that one was supposed to be up there. A book on my personal finance. It's something that came out right. It came out as the market crashed in the Great Recession. So heck of a timing. And I think some of us are still trying to recover from it. So with that, I'll put it back here on the company. I'm impressed with what they're doing. I wish them well with it. I like the fact that it's a simple story. It is a simple story, yet it's incredibly complicated and complex and impressive amount of research and technology that has to be developed before some very impressive treatments might be developed and available to people. So I'm looking forward to that day. In the meantime, keep tuning in. And if you have any questions, send me a note, and I look forward to hearing from you.